So I feel the most pressing challenges for the healthcare systems today are increasing cost, decreasing reimbursement. In the state of New Mexico, particularly, we're facing deteriorating payer mix, very limited commercial market. And the fourth one I would say is, our inability to hire and maintain qualified staff. I think the main two that caused us to seek a partnership with Capta would be our desire to increase our reimbursement to ensure we're getting paid every dollar for every service that we provide, and that we have the processes and safety nets in place to make sure we're doing that. The other piece of it I would say is, continuing to reduce our cost to collect. We have a very low cost to collect of about 2.5%, which beats national benchmarks, but it's still not good enough. It's still not good enough in our state. So we continue to seek more ways to lower those costs. I think the successes that we've had with Capta specifically and within the revenue cycle, they can translate into the other areas of the organization. Presbyterian right now has a mentality of trying to innovate. We've always been into innovation, but we really are seeking new ways to innovate, improve our processes, do healthcare differently, because that's really the name of the game in terms of being able to reduce cost, improve reimbursement. And I think what we've been able to demonstrate with Capta is that we've been able to improve an already very strong performing revenue cycle. We have limited resources as both a state and an organization. And so what Capta has been able to do is really open a pipeline for us of opportunities, initiatives, things that we knew needed to be done, but didn't have the capital resources to do, didn't have the human capital to do, and in some cases didn't have the expertise to do. And so partnering with Capta has allowed us to kind of fill all those blanks, if you will, and be able to fully execute on all of that. We don't have enough people to do the work that we do today, right? We don't have enough to hit every box that we need to. What Capta has allowed us to do is improve automation, on the more mundane work, improve, our bot, our RPA technology. And what that's done is then we call it upscaling here at Presbyterian, but we've really been able to upscale our people and focus them on the more complex work, the work that requires, a lot more thinking. And, the feedback that we've received from the staff is that they've been very engaged by that, and it's actually improved their satisfaction. The relationship with Capta is we really view them as an extension of our leadership team. We really view them as, additional SMEs we can bring to the conversation, different viewpoints. They have additional expertise and, they've been in different parts of the industry. Many of us here at Presbyterian have been at Presbyterian for an extended amount of time, so they bring new outlooks and viewpoints, and it's been extremely helpful for us. And, if for someone sitting in my seat, I would just encourage you to, listen, embrace that, and really focus on the partnership and think about it, like I said, as an extension of your leadership team and what you can do with that. That's primarily what they're doing. They're out there, scouring the market, figuring out who are the best partners, what are the best processes, and then bringing them to us for discussion. And that's something that, any leader in revenue cycle is busy. And that's something that we don't have a ton of time to do. And so the partnership has really helped us navigate and have a lot more opportunities to review and reveal. A lot of vendors want you to hand everything over to them, and then you see if they can reduce costs, increase revenue, right? Capta's investing in Presbyterian. They're investing capital and allowing us to kind of make those steps. I don't want to say risk-free, but it's pretty risk-free from that perspective, and that's unique. I think the only way you're ever going to achieve, the next step in innovation is the AI, right? Generative AI, et cetera. That is extremely expensive, right? To build, to develop, et cetera. So I think that you're going to have a partner like a Capta or other partners like that are willing to share some of that expense. If you're waiting for the healthcare systems to develop generative AI, we're going to be here a while because they just don't have the resources or the capacity. So I do think that that's kind of our next step, if you will, evolutionary step from a healthcare perspective, is being able to leverage and share that risk across the board. You know, as a vice president, you take pride in the organization, you take pride in the results that you have, and we have a high-performing revenue cycle. So I would encourage anybody, though, to kind of take down your armor and really look at the opportunity, evaluate it. Don't be defensive. You know, there's a lot to be seen and learned there, and remembering that you can always do that from other people, and the expertise that Capta brings allows us to do that. But it's only natural to be defensive. It's only natural to say, I don't want someone coming in and stepping on my revenue cycle or my organization or trying to run it. That's not what Capta is trying to do. Capta is trying to partner. They work with you alongside the leadership team to develop strategies that help you get better at the things that you want to improve on. Like any organization, we have more denials than we can fend off, if you will. Providers, or I should say the payers, continue to increase their automatic denials, and so our volume continues to go up. And so we've been able to work out a strategy with Capta that first fills our void where we can't work the volume that we have, which has been incredibly helpful. It's also allowed us to focus our internal resources on the more complex denials, which has been helpful for that, because it's not something you can automate. It's not something that's more easily, to get a positive outcome from. I think the other part is, as we've expanded beyond the revenue cycle, we've had to partner with folks that maybe not our traditional partners that we have strong relationships with, but, we've gone out and spoken to them, but immediately brought Capta and the Capta team to the table. And so what that's allowed us to do is really allow a broader part of the organization to get involved in Capta, to get involved in the opportunities that might be available, all the while making sure that we are respectful of their expertise, and at the same time letting them know that at the end of the day, it's their decision. It's their decision, it's their operation still. But they're gonna get a lot of influence and feedback from Capta in the process to be able to make the best decision for Presbyterian and the best decision for our patients and our members. We've got more than enough work to do, and we have expanded organizationally. Like, we've added hospitals, we've added ASCs, we've added freestanding emergency rooms. We haven't added any staff to the revenue cycle in over a decade. A matter of fact, we're a fraction of the size that we used to be. So we have to continue to reinvent ourselves in order to succeed and help the organization succeed.